How you doing? I'm Dr. Raj with Goshen Family Chiropractic. Today I want to demonstrate how I go through the Webster technique, what I look for, the protocols I look for, what muscles are imbalanced, and then the adjustment. So what I look for normally is leg length, okay? And I want to see if there's an imbalance in the leg length. And when I see this, Miss Jen, her left leg is short, so that tells me that the muscles on her left side are being contracted, and we got to adjust that and fix that. So we want to see how that is working, and then I also bring the legs up, okay, and I press each leg into the pelvis, and I see which one is more restricted today. And today they're about even, so that's good. She's been working with us for the last few weeks, so that's good. Usually if I see some tightness on one side, that tells me that her SI joint, either one side or the other side, is tighter, or it's locked up or fixated. But for Jen, they're both even. There's two main muscles I look for that can be tight or imbalanced. One is the piriformis muscle. The piriformis runs from the tailbone out to the hip, so I want to make sure that those are even on each side. Sometimes there's imbalances in them, and we want to, again, even them out from left to right, right to left. So usually her left piriformis is tighter than her right, so we'll do a quick sweep of that piriformis muscle and on both sides to just help to work the myofascial lines of that piriformis muscle. And then I recheck, bring the legs up. Good. Still some restriction on this right side, so we'll actually use the drop table to help get this SI joint moving better. Good. Very light adjusting. Good. Good. Our goal is to create balance within the pelvis. Okay, recheck that. Awesome. Good. And then we'll check her lumbar paraspinal muscles. Make sure that they're balanced even from right to left. And then today, her right side is just a tad tighter than her left side. So what I'll use is the arthro stim to get these muscles in her low back start to relax. So they'll start to relax here. And then we'll check in again. And there's less tension on this right side. Good. And then I have Miss Jen. She's going to turn on her back, face up. Muscle, or the second main muscle group that we look for, is the hip flexors, or specifically the psoas, or the iliopsoas muscle. It's a group of muscles that attach onto the spine, the lumbar spine, runs down and attaches onto the inside of the thigh bone, or the femur. So we check, the way we check this is we have Jen, we raise the arms, and I check in for tension on one side or the other side, okay? I also look at, when she sticks her fingers out, we want to see them nice and even, okay? If we have it, you can relax your arms, where it's left short on one side, we know that there's some contraction on that one side, and we want to balance that out. So Jen, her normal pattern is that her left hip flexor is just a tiny bit tighter on the left than her right. So the way we want to relax the left hip flexor out is using a lot of sustained contact with very gentle massage of that hip flexor under the belly. So the way we do that, just gently press onto that left hip flexor. And you're okay, right? This does not hurt?
No.
No. See, it's very gentle. Getting that left hip flexor. Breathe. Good. And then we recheck, have our arms come out, stretch them out, and then that pretty much balances the left hip flexors. Now, with driving and walking and just normal life, that side can go back. That's why it's important that we just check in to see and create balance within the pelvis every time. And then for Jen, the cervical spine is very involved in the parasympathetic nervous system. So we want to make sure that there's no stress going on in the mom's body during this process. So we just want to keep the parasympathetic and the stress down. So I do an adjustment for Miss Jen here, very gentle cervical adjustment here. Good. And then a little on this side. Good, perfect. Good. And then recheck everything. So legs are balanced, hip flexors balanced, everything is good, and that's pretty much the protocol for the Webster technique, is looking at pelvis, SI joint, piriformis, hip flexors. You can look at pubic bone if you need to, if a mom has been pregnant before, and any other imbalances that may be happening with the body. So yeah, that's the protocol, and if you have any questions, please ask me.